Hi everyone, it's Dr. Tim Newton again with Inspire Movement Physical Therapy. Here we're going to talk about our mechanical approach to dealing with shoulder pain. Very often, pain in the shoulder is right in this region. But what we need to remember is that this area here, the rotator cuff in particular, is very often the victim and not the cause of what's going on. And what I mean by that is that even though you're feeling pain here, it's because other parts in the body are not doing their job. Specifically, we want to look at little joints here, and in the upper spine to make sure that they are moving adequately and the muscles of those regions are firing adequately so that excess stress and burden is not put on that glenohumeral joint, that ball and socket joint that has the rotator cuff muscles. All right, so we find this very often clinically that shoulders will just get better and we don't even really fuss with this area because we have properly addressed the restrictions elsewhere. So let me just show you very quickly some of the areas that we check often. Like I said, we check the upper thoracic spine and the cervical spine. We've got videos on how we do that. I'll definitely check those out on your own time. It's worth it. The thoracic spine needs to be able to extend, especially with overhead mobility. If you were to slouch, so go ahead and slouch down chin to chest, and then try to lift your arms up overhead, so go ahead and lift up, you'll stop at a certain point. But then if you let your spine finally straighten up again, go ahead and straighten up, you get a little bit extra after that. We'll do it again so you can see. So go ahead, down, all right, and lift up, straighten up, and you can see there's a little bit extra movement happening with her arms. All right, so the reason for that is that when the spine can extend, the shoulder blades can finally tip back and up to enable our arms to get up overhead. So there's a very important relationship between the spine and the shoulder blades and the shoulder itself. It cannot be forgotten. We can't spend all of our time just mobilizing this joint and stretching this joint without getting at the underlying issues that are causing the pain and the dysfunction. Another thing that we want to look at, and this is also very important, is mobility at the collarbone where it meets the sternum. This is called the sternoclavicular joint for you anatomy gurus out there. So go ahead and turn and face me. And I'm just going to show you a very quick assessment that we like to do for this joint. You can just come right in here. Okay, shrug the shoulders up to the ears and back down. So this gives me an idea, go ahead again, of how well, and back down gently, of how well her shoulder blades go up and down, right? That's very important. 1/3 of all of our shoulder mobility is coming from the scapula, right? The scapula is connected to the collarbone and they move as a unit. If we're missing out on this, all of the excess burden is going to that ball and socket that's doing the other 2/3 of the motion. We can also look at how well she comes forward. So go ahead and bring your shoulders forward and relax, and then squeeze your shoulder blades together and back and relax. So I just look with my thumbs and I can compare side to side and see if there's any asymmetry or restriction or apparent muscle tightness. We have a video where we deal with this restriction by treating the subclavius muscle, which is a little muscle down here that helps us to get more mobility in that shoulder joint without even, like I said, going to the joint itself and stretching it. And this is just because they're all interconnected and related, and we need to be getting at these roots of the problem. So we'll take a look at the upper back and rib cage mobility. We'll take a look at the sternoclavicular joint mobility, and we'll also take a look at the neck mobility. All of these things can help to give you more shoulder mobility by treating these different regions without even touching the shoulder. So we'll just do a quick neck rotation. Go ahead and turn both ways. Yep, and then the other way. And we'll look at how well she goes up and down as well. Right, and these are just ways to give us a clue as to where we need to work. So that's pretty much it. It's all connected. We need to look at it all, and we need to look at it all very carefully.